Fetal alcohol syndrome is a preventable condition caused by maternal alcohol use during pregnancy. The condition impacts children physically, mentally, and emotionally. Fetal alcohol syndrome directly impacts occupational performance, causing delays in gross and fine motor skills, sensory processing issues, difficulties with emotional regulation, and impaired cognition. Not only does fetal alcohol syndrome affect the child, but it can also have a tremendous negative impact on the whole family, leading to maternal guilt and resentment from family and friends. This video will provide a simple case study of Wendy, a child with fetal alcohol syndrome. I will be discussing Wendy's occupational profile, occupational strengths and concerns, and underlying factors of her condition. Additionally, I will identify which occupational therapy frame of reference best encompasses the foundations of treatment planning and therapeutic interventions. Wendy is a 5-year-old girl diagnosed with fetal alcohol syndrome. She lives with her mother, Cindy, and her 9-year-old older sister, Clara, in Baltimore, Maryland. Wendy's hobbies include finger painting, playing outside with sidewalk chalk, and playing on the swings at the playground. Wendy's mother is seeking occupational therapy services to improve her school readiness skills, preparing Wendy for kindergarten this fall. Cindy is concerned for how Wendy will perform at school due to her issues with fine motor and gross motor skills, emotional regulation, social skills, and sensory processing. Due to her condition, Wendy struggles with age-appropriate tasks such as using utensils, drawing, managing food containers. Additionally, Wendy demonstrates poor core strength and postural stability and is noted to slouch or fidget excessively when engaging in tabletop activities. Regarding emotional communication and social skills, Wendy struggles with using effective communication, sharing toys, taking turns, and mood stabilization. Her mother reports she has severe meltdowns when she does not get her way and when there is a change in her typical routine. She also reports that she often lashes out at her older sister and they have a strained relationship because of Wendy's outbursts and poor boundaries. Lastly, OT services are being referred to address Wendy's sensory processing skills. Wendy's mother knows that she becomes overstimulated in loud, crowded places and has difficulty focusing in foreign directions, especially when she's overstimulated. Two main occupational concerns are school performance and social participation. So addressing school participation, Wendy has challenges with gross and fine motor skills, and that will result in difficulty with school-based tasks such as engaging in classroom activities such as writing, cutting with scissors, and coloring in the lines. Also, because of her poor postural control and abnormal tone, this might lead to hypermobility, reduced strength, and challenges with occupations, sitting upright at the table, or playing on the playground with peers. Additionally, children with FAS are known to struggle with social participation, and as in this case, Wendy really struggles with interactions with her peers. So this is because of hearing and speech deficits, which make communicating with peers extremely difficult. This can be exacerbated by other conditions such as impulsivity and poor emotional regulation skills. So when we're thinking about occupational therapy strengths for Wendy, I want to highlight play and leisure and ADLs. So Wendy is a generally happy, energetic, fun-loving 5-year-old girl who enjoys playing with her toys, running around on the playground, and partaking in social and pretend play activities. Typically, play activities do not indicate expectations, so Wendy will have the freedom to play in a way that best suits her wants and needs. Developmentally speaking, most typical 5-year-olds are independent with ADLs such as dressing, bathing, hygiene, self-feeding, and toileting. With the appropriate activity and environmental modification, Wendy can also be independent ADLs. For example, children her age are still wearing clothes that are easy to take on and off and do not require management of multiple buttons or fasteners. Additionally, her peers may just be starting to tie their shoes, so Wendy will be just fine with her Velcro shoes, and they're developmentally acceptable for her to wear at this time. Although Wendy may require assistance with some aspects of ADL performance, such as zipping her jacket, cutting her food, or managing food containers, ADLs are not the most significant focus area for her at this time based on clinical observations and parental concerns. I want to talk about some underlying factors of fetal alcohol syndrome. So it's important for the OT to consider these underlying diagnostic factors during the assessment and intervention because they have a tremendous impact on Wendy's occupational performance. For example, if Wendy is not able to hear the directions clearly during the assessment, the OT may assume that she does not understand the directions or has greater skill deficits than she really does. Also, if she struggles with auditory processing skills, the OT will want to implement visual aids to maximize success with an activity. Lastly, an OT will want to grade activities appropriately, including auditory training methods and interventions to support Wendy's ability to understand and execute multi-step directions. So this might look like giving her a one-step direction, building her tolerance, remembering and understanding 1 to 2, and then introducing 3-step directions. So when we're talking about learning disabilities, children with fetal alcohol syndrome struggle with executive functioning skills, impulse control, and sensory processing skills. All of these factors are going to impact academic performance. The OT must consider the child's learning style and potential learning disabilities so they can work with the child, the caregivers, the teachers, and the school counselors to develop an IEP or 504 plan that best meets the needs of the child by considering her strengths and her weaknesses. Okay. Also, if left unaddressed, learning disabilities can lead to the child disliking school and demonstrating poor self-esteem and self-efficacy due to the learning differences. Lastly, mental health conditions are a really, really big underlying factor of fetal alcohol syndrome for both the child and the mother, and maybe even the whole family. So ADHD, depression, mood disorders, bipolar, anxiety, different personality disorders, they're all prevalent in children with fetal alcohol syndrome. In utero, alcohol was transmitted to the baby, which impacted the development of brain structures such as the limbic system and prefrontal cortex. This resulted in issues with emotional regulation, impulsivity, and mood stabilization. Mental health conditions may impact Wendy's engagement in social play activities such as sports, board games, and imaginative play. If she has difficulty regulating her emotions, she might have outbursts and over losing, and she might not be able to play the rules of a game or just kind of follow the social norms interacting with her peers. The two main frame of references used in this case study are developmental frame of reference and sensory integration frame of reference. First, the developmental frame of reference supports this case study as Wendy's condition has impacted her gross and fine motor skills. For example, Wendy struggles to use coloring and writing utensils such as crayons, markers, and pencils. This will negatively impact her performance at school and may result in reduced engagement in school activities such as writing her name and coloring in a picture if not addressed by the OT using developmental perspective. The developmental frame of reference identifies strengths and weaknesses of the child, in this case Wendy. Therefore, if Wendy is able to complete pre-writing strokes and sustain a tripod grasp maybe 75% of the time, the OT's intervention can focus on handwriting skills. However, if Wendy is using a palm or a fisted grasp while holding a crayon and is unable to create vertical, diagonal, and horizontal lines, the OT will focus interventions on improving hand strength and visual motor and visual perceptual skills before attempting any handwriting tasks. Okay. When we're thinking about the sensory integration frame of reference, I chose this one because Wendy has auditory processing issues, behavioral challenges, difficulty with focusing, and emotional regulation issues. So all of these factors really encompass the sensory integration approach. Also, this frame of reference can help Wendy tolerate loud and crowded environments by improving her sensory threshold, providing environmental modifications, and engaging her in auditory training interventions. Lastly, sensory support such as headphones and a weighted vest can help improve emotional regulation and reduce the prevalence of maladaptive coping mechanisms for Wendy. This tool promotes critical thinking by reflecting on the occupational profile and promoting an increased understanding of the client's objectives and family concerns. Using the process analysis tool has enhanced my ability to assess, evaluate, and create a treatment plan for patients based on their diagnostic implications. The tool also facilitates clinical reasoning skills using theories and frames of reference to guide treatment approaches and interventions. To conclude the case study, I just want to talk about some suggestions for learning. So as an occupational therapy student, it's really helpful to have opportunities to review case studies that portray a variety of client populations and occupational performance concerns, and this will help expand my confidence with treatment planning and improve my clinical reasoning skills. Also, providing real-life observations of OTs interacting with their patients and providing observations of screenings, assessments, evaluations, reevaluations, and interventions. So just the more observations in real time and real life examples, I think that would be helpful to enhance my clinical reasoning skills. Also, evidence-based practice and research assignments promote an increased understanding of how diagnosis impacts occupational performance, and that helps me determine which frame of reference to use, which assessments and interventions are best going to target the therapeutic outcomes, and what is going to be the most effective for that specific patient population. So all of these things would be really helpful just to enhance my learning and make me the best OT that I can be.